Hi, I'm Jennifer Bain. I'm a child neurologist at Columbia University in New York City. I am first off very appreciative for n-Lorem to having me back a second year to update everybody on our progress. So in terms of full disclosures, I do have some research funding from Arizona. I've also had some lovely donors that have really been able to kickstart our precision therapeutic program at Columbia. But I think the most important thing here is that I am a physician first, and that really is my goal in this project. I am a scientist second, but my goal is to be a physician and to take care of patients. As a neurologist, I'm sure many people have sat in this room where they go to the doctor. They want to know what's going on, but they also really want something to do about it. And as a neurologist, we often don't have the ability to, number one, say what we think is going on, and number two, be able to treat it. So I work at New York Presbyterian, Columbia University Irving Medical Center. And first and foremost, do no harm. And I think Dr. Crook often says this. Our job is really to do no harm for patients and provide evidence-based, key evidence-based information for things that would be helpful to our patients. Where our goal is to protect our patients, but to be very transparent. And it's been really a pleasure working with n-Lorem over the last few years, as you just saw earlier in Lori's talk, really being honest about what's going on as we're endeavoring on this amazing horizon of new potential treatments. We need to be honest with ourselves and honest with the community about what's happening, what's going well, what's not necessarily going well. And while we do have HIPAA and we really try to be as ethically compliant as we possibly can, we're appreciative of families like Susanna and Sloan and everybody really being honest about their stories. So thank you to the families who are willing to say their children's names. And as much as a researcher, I'm supposed to say subject. Frankly speaking, I am a doctor first, and so they're my patients. So the goal of this is to really learn from the clinical trial experiences from the last 2 years, bring it back to patients in the trial, both at our site as well as other sites. As Lori mentioned, we really work closely with not only the n-Lorem board, but also other clinicians who are doing or trying to kickstart similar programs for their patients. You certainly can't do it all in one institution. So I'm going to give some updates on our first 2 KIF1A patients being treated with the same ASO. I'll talk just briefly about how did we transition out of the clinical trial that we had heard about earlier today, that first 2 years of clinical trial, and then how did we continue on and how are we continuing on as the clinical treatment chapter. And then I'm just going to briefly talk about funding because I know people often ask how does this actually get done, and it does change from institution to institution and patient to patient. So for those who were not here last year, we presented on a case who initially was spearheaded by Dr. Wendy Chung, who you'll hear from tomorrow, her team, including Joanne Carroll up at Boston Children's now. They really were able to put this into motion, and I'm sure it involved so many leaps and bounds. Susanna had her symptom onset in infancy with concerns for global developmental delay from a very young age. And prior to her treatment started at 8 years of age. She had developmental delay as well as some regression, delays in communication. And again, some of that regression was around the time of 4 years old. She had been walking pretty well, and that seemed to slow down quite a bit. She had progressive spasticity that was associated with significant pain. As a parent, seeing your child in pain and vomiting is not something that anybody really wants to see, and really just aches for their children. In terms of epilepsy, that crept up a couple of years later and became what we call medically complex and medically refractory because she required several medications. This led to many hospitalizations and many monitors with that squiggly line cap called the EEG. Optic nerve atrophy and progressive cerebellar atrophy have contributed to difficulties with vision, as well as coordination and tremors, and really just a loss of independent mobility. And as we want to see our kids grow up and gain skills and be more independent, relying on a wheelchair when you're that young, I think is certainly a scary thing for a parent. In terms of the genetics, we know that she had a de novo, meaning a new from her, missense typo or mutation, and it did have a dominant negative effect. Dr. Schneider talked earlier about how some of these genetic variants actually cause a problem, and they cause a problematic protein to be built, and then it kind of gunks up the system. The gene itself is called KIF1A, which is a part of the kinesin family of motor proteins. Susanna started her program at 8 years of age, and I think many people have seen videos of her and her face on n-Lorem's website. In terms of our treatment goals, and this is really key for when families and clinicians are starting to think about this, as much as we want to have a clinical trial that's going to be shown to be effective, we really need to make sure that that primary goal should be something that we can measure and something that's clinically useful and clinically important. And so improving seizure frequency and severity was the first primary goal of their trial. The second goal was to improve her mobility and at the same time improve spasticity, which secondarily led to some neuropathic pain. And at this point, we are now 14 doses into the study drug, at which point her highest dose has been 100 milligrams. She completed 2 years on October 10th, and she's now officially in year 3. We actually are running out of room on this space, so I can't do this anymore. I think we're gonna have to shift our graphics. For those who might have seen, we did have the opportunity, Dr. Chung published this last year. This was after the first year of treatment. So up here on the top left, you can see these are all the episodes that were concerning for seizures. We call them epileptic events, encephalopathic events where she wasn't engaged. She wasn't able to really engage with her parents, her family, her school, or to learn. And then after treatment, there was a significant drop. This is where it's really critical to have that baseline data so you can see what happens before treatment, what happens after treatment. In terms of neuropathic pain, again, seeing your child in pain is probably one of the hardest things as a parent to see. This was her pain levels that were rated by her parents. And at this point, we're now at least a year off of gabapentin standing. And so I think that's really wonderful. In terms of quality of life, green is good. So on the left is the start of the trial, and on the right is where we are now. And so you can see in that first year of life, many of those different domains in terms of the quality of her life have turned green, have turned good. And we have very many fewer those red bars that we had seen earlier. This is from Parent Report. And as noted earlier, this has been published nicely. So I'm gonna try to play these videos. She's so young.
We'll go, and then we'll come back towards you.
In terms of KIP1A, for those who want to know about what this clinical picture looks like, some children do have more of a global developmental delay with a hypotonia picture, and then others do present with more of a spastic paraplegia. They might fall into the bucket of a hereditary spastic paraplegia on the differential. The genetic disorder often will come up on whole exome sequencing, cerebral palsy panels, HSP panels, as well as epilepsy panels, optic atrophy as well.
Good job.
Uh-oh, let's go back. I want to show that second video. Let's see. I clicked too fast. One more?
I'm really, really happy.
What are you happy for?
My dance class.
Yeah, we're so thankful for you, Lauren.
Yay! I'm so thankful for you to sign me up for a dance class.
There be sunlight in the picture?
No. What? Watch my shop.
Nice, Suze. You're really good.
And so as you can see there, she really started to do quite well. Yes, I agree. However, the journey continues. So we moved out of year 1 where we had made so many wonderful gains, and last year I stood here and told you all about all the wonderful things that have happened to Susanna. And guess what? She did have a lot. She continues to have a lot of good things, a lot of great things. However, things do change, and we know that this isn't necessarily a cure. And so things have kind of updated since that initial presentation. So we've had a couple bumps in the road. As you just heard from Lori, she started having fevers and reactions after the dose. And we're really working through that. She has significant fever, nausea, vomiting, and fatigue for a few days. We did start using some pre-dose steroids. That did seem to help bring down the fever a little bit, but surely expecting what's going to happen after dosing day, every dosing day, has been very challenging for the family as well as myself and my team. We have reported this to the FDA, the n-Lorem Data Safety Monitoring Board, and many other n-Lorem clinicians who will potentially be utilizing this, and we want to make sure that this is open and transparent to the community. We're continuing to work with the clinical team at n-Lorem, as well as many experts in the field of those phases of complement activation and cytokine panel signaling, which I certainly do not remember in medical school at all. So I really appreciate the multidisciplinary discussions that we've really been having. And in terms of how she's been doing, she hasn't really had much improvement with her reflux, and that's been pretty problematic. She unfortunately had a couple falls and some fractures. This led to some motor deconditioning. If somebody's not walking because they have to heal, then they're not able to get their physical therapy, and then it just makes things more and more problematic. And so do we say, okay, this is due to the falls, then the deconditioning, or is this actually perhaps the underlying disorder that's kind of creeping up? And it's really hard to tell. And during that first year, we were really challenged with, well, do we push her to get that 6-minute walk test because we told everybody that we would get the 6-minute walk test and we're gonna do the fall diary? Or do we have to shift how we're thinking about her and what we're gonna do to measure success and not make somebody feel bad that things are changing as they get older? She actually, in the last probably 6 months or so, has really transitioned and owned the motorized wheelchair, and I think that's been a phenomenal plus. So in my opinion, I think we've shifted our goals for her because we've really been able to shift what our mindset of what we think is important to her. And she's had some other episodes. While she doesn't have those episodes she had years ago, she's having these new episodes. We're working through whether or not these are catatonia, these are cataplexy, these are non-epileptic episodes, and we don't really have a clear answer. And I'm not sure when we'll get that clear answer. We're learning more from the KIF1A community as well about what these are and how do we treat these clinically. So again, you saw that significant improvement in those clinical episodes that we saw at the very beginning, but we are seeing other things that are creeping up. We've continued to see improvement in that quality of life. So this was that original graph that I showed you at the beginning. So that was year 1, where we saw a lot of great changes. And then we started seeing some dips. So we're going back to a couple yellows. We haven't gotten back to the reds, and there are still some greens out there. But on a positive note, we have been able to add some measures that we weren't able to do a couple years ago. So she really wasn't able to feed herself quite well. She had difficulty drawing a circle. And the 9-hole peg test is a test that we'll often use to kind of see how the fine motor control is for somebody on a clinical trial. We couldn't even do that before because she wasn't able to do it cognitively, attention-wise, as well as the fine motor component. And actually now she can do the 9-hole peg test, and she's getting better with time on it. She's able to feed herself, and she's showing improvement in her ability to draw and draw circles. And so I asked Susanna, actually this summer, before the summer meeting, I said, what do you want to tell other people if they're thinking about going on this medication? And she said, be brave. And then she proceeded to come up onto stage and sing the national anthem. So I would say that certainly wasn't going to happen before the trial. And we're going to show some other videos of things that Susanna has been able to do even since these fevers came up and she started not being able to walk independently. Let's see if this works. No. Can you make it work on your end? I just see everybody going like this. Can I press it? We're just gonna do it manually. Gotta be flexible with clinical trials, gotta be flexible with presentations.
Go Suze. Go Suze. Watch out for any obstacles. Yes. Chin up. Nice job.
You can go to the next one. Thank you so much.
And we're gonna do a big push off. Right in. Nice, Suze. Remember, nice and slow. Nice and slow. All right, bring your hands up first. Hands up. As high as they can go. And one more big push. This might be it.
missed a step that time.
You go to the next one.
I think you definitely skipped.
Lori mentioned navigating the streets of New York City, who,
Okay. And you're gonna
by
turn
herself.
left and stop.
using her own motorized wheelchair.
Left is which way?
For those who don't know how to navigate New York City streets,
Turn left.
I think this is a pretty big plus.
Right.
I
And
think
stop.
Dad told me a couple weeks ago, she told him that she wanted to go on that street instead of that cross street because that cross street had more interesting construction going on. These are the types of things that you're not going to capture in a quality of life caregiver report. And then the last one, please. Thank you. And this one was just last week, feeding herself. So the amount of independence for a teen girl in New York City, I think really has continued to grow and blossom. And so while she's not necessarily doing the fall test and the 6-minute walk test, we've certainly continued to see significant gains for her. And I think that's really important. Since the study started, we did have some significant improvement in the seizures that she had before, significant periods of seizure-free days. Her neuropathic pain is markedly improved. She is no longer crying in pain every day. Her communication has improved. She can narrate her day to parents at dinner. As I said earlier, she sang the entire national anthem without taking a breath. Her motor function and her fine motor skills have continued to improve. And then there were things that we weren't even really expecting her ability to do, like navigating the streets of New York City, toileting by herself. And so her diagnosis still is there. She still has CANT. But this is a treatment, this is not a cure, and we're going to continue to see the gains that she's been benefiting from, and we're continuing to talk about risks and benefits. I'm going to swap over to our second patient. So this is Sloan. Sloan also was diagnosed in infancy with KIF1A. A little bit of a different trajectory, a little bit of a different young lady. She has hypotonia, developmental delay, some optic atrophy, cerebellar atrophy. We started her treatment 5 years earlier. And so at that point, we did learn from Susanna because we said, well, actually, the motor piece was really big here, and she wasn't having seizures, so we didn't need to use that as our primary outcome. We really were looking more at motor control. But as I think we heard earlier today, communication is really something that I think a lot of parents are really aching for. And so communicating with their children was a secondary goal for us, and hopefully delaying seizure onset. In terms of exploratory goals, seeing improvement in her sleep, improvement in just her everyday activity. And so she was very different in that she was earlier on in the disease. She had a very different clinical presentation. And even though there's a fair amount of natural history study out there, we don't know what every patient's going to happen, whether they're getting treatment or not. So these are some videos from her before. Oh, these ones worked. I'm going to go through a little bit because I did show these last year as well. She's received 8 study doses of the drug, the highest dose of 80 milligrams. As we heard about earlier, we were concerned about whether or not this was an ASO-specific concern or whether or not this was a patient-specific concern. She's gotten multiple doses of 80 milligrams without any side effects whatsoever. And so we do think that for patient number 1, it probably is more likely a combination of disease and the medication. After 1 year, we've seen stability in her motor skills using the gross motor functional classification skills. Her parents notice improved spasticity in her legs and many fewer falls while she's at home. In terms of her communication, she's seen improvement in her ORCA, which is the observer-reported communication assessment, so improvements especially with receptive and expressive speech. And in terms of daily living skills, improvements in communication, behavior, her motor skills. She hasn't had a lot of household tasks that she's been asked to do, but really no change there. There are potentially some declines in some of the personal areas, but I think this is more the nuances of the way the questions are being asked with some of these younger kiddos. So in terms of her journey, we're learning from her, and I really am appreciative that she's trusted us to do this alongside of Susanna so that we can learn from both of them. She's had no regression in her motor skills. She's had meaningful gains in speech. You can talk to her grandfather who's here today. She's had no evidence of seizures. She's more cognitively engaged and aware, and she's had no side effects from seizures. So unfortunately, this video was already shared. Thank you so much for showing that, so I don't have to show it again, but she's super cute, and she can tell you all about how strong she gets after her treatments. So in terms of shifting from the clinical trial to clinical care, we will, as you heard about earlier, we work with the clinician and we work with n-Lorem and the family to say what is the right amount, what is the right frequency, and then really talking to the FDA about saying what is safe for that person. Things that we've changed, we've taken out the 6-minute walk test, we've taken out the fall diary, we've added in some more non-epileptic seizure types, and we're looking more at tremor and hand function as well as changing some of those quality of life measures. And then just a last plug, because we all like to talk about money. Everybody says, how are you going to be able to do this? Transparently speaking, the start of the clinical trial was funded with research funding only in terms of everybody. However, after we saw significant improvement after that first year and a half, we decided to see if insurance would cover the dosing. And so we have transitioned some of the costs through the insurance for patient number 1 after we were able to show that, yes, this was a clinically meaningful for this patient. And for starting patient number 2, we actually did start from the very beginning. We've had not a lot of roadblocks from the insurance perspective, but I think that's a global issue that the whole group as a whole is going to start talking about. But it's important to recognize that insurance isn't going to pay for everything, and that's very likely they're ever going to cover, right? They're not going to pay for our clinical research team who's in the room and taking the biospecimens. They're not going to pay for that research pharmacy that actually administers all the medication. We do a lot with our ethics board at our local institution and maintaining that, and that's a lot of time. And in terms of biospecimen collection and other research study, they're not going to be covering for that. So these are just larger discussions that the group as a whole has to continue thinking about. Lastly, I just want to say it really does take a village. The clinical trial team may or may not be your clinical provider, and so that's really important that you have your clinician as well as the clinical trial team there as well. The clinical trial team will really try their best to be blinded because we really want to be as rigorous and thoughtful when we're receiving information. However, you still need to have maintain your clinical care. You're still going to be having episodes concerning for seizures and falls, and you need to make sure that your provider and your treatment team are really well aligned so that you can collaborate really closely. Having that shared decision making is really critical when weighing the risks and the benefits of a particular treatment. Being thoughtful about natural history studies for those groups who are younger out here, I think, is really important so we can know what's actually going to happen if you're doing a treatment or if you're not doing a treatment. What happens after that trial period, we have to be flexible with thinking about clinical outcome assessments depending on how things evolve with regards to that person, that disease, and that potential response to treatment, and really refining those outcome measures after that initial trial period is over. Importantly, just work with your clinical team, work with your clinician, work with the research team. We really need to be working all together, and n-Lorem's been phenomenal to partner with on. And just remembering that this is a treatment, this isn't necessarily a cure, but it surely is showing a lot of promise as a disease-modifying treatment. Thank you to all the families and all these other collaborators out here. I'm really appreciative, and then most important, all the girls. Thank you.